You look at yourself in the mirror every day. You observe your face, your hair, your skin, your clothes. But tell me honestly, when was the last time you stopped to look at what your own body eliminates in the toilet? When was the last time you paid attention to that simple, quick, seemingly unimportant moment that happens almost every day of your life? Maybe never. Maybe you've always flushed immediately, without looking, without thinking, without reflecting. And that's exactly where one of the biggest silent dangers to your health lies. Because while you ignore it, your body is speaking. While you pretend not to see, it is sending signals. While you believe everything is fine, it may be trying to warn you that something serious is happening. And many people only realize this when it's already too late. Most people waste, every single day, one of the most important and free health exams that exists. An exam that costs nothing, requires no appointment, no insurance, no waiting in line, no authorization. An exam that is available in your own home, in your bathroom, every morning or night. And yet almost no one takes it seriously. You wake up, go to the bathroom, do your business, and simply leave. Without observing the shape, without noticing the color, without paying attention to the consistency, without noticing the smell, without paying attention to the frequency. And day after day, you throw away valuable information about what is happening inside your body. Many people only seek medical help when the pain is unbearable, when bleeding appears, when weight loss is visible, when weakness takes over, when cancer is already advanced, when treatment becomes harder, when chances decrease, when fear becomes reality. And much of this could often have been avoided with one simple habit: looking into the toilet. Your bathroom is, in practice, your personal laboratory. A laboratory that works every day. A laboratory that analyzes how your intestines are working, how your digestion is functioning, how your food is being processed, how your body is reacting to stress, medications, emotions, and disease. Doctors around the world use a reference called the Bristol stool chart to interpret these signals. It divides stool into 7 different types, each revealing something important about your health. Type 1 consists of hard, separate pellets like small stones. It usually indicates severe constipation, lack of water, lack of fiber, slow bowel movement, difficulty passing stool, pain, excessive straining. Type 2 looks like a sausage but with lumps. It also indicates constipation. The intestines are working with difficulty. The body is drying the stool for too long. Type 3 looks like a sausage with cracks on the surface. It is closer to ideal, but still shows minor warning signs. Type 4 is considered the healthy standard. Soft, well-formed, smooth, easy to pass. It looks like modeling clay. This is how your body should function most of the time. Type 5 consists of soft blobs with clear edges. It indicates mild lack of fiber. Type 6 is mushy stool with no clear shape. It may indicate inflammation, food intolerances, stress, or infections. Type 7 is completely liquid, diarrhea, red alert, possible infection, inflammation, intestinal disease, or dehydration. Now think, which type appears most often in your life? Do you know? Or have you never paid attention? Besides shape, color also speaks. Brown stool is considered normal, coming from bile produced by the liver. When color changes, your body is trying to warn you. Very pale or whitish stool may indicate liver or bile duct problems. Black stool may indicate bleeding in the upper digestive tract. Reddish stool may be a sign of fresh blood. Yellowish stool may indicate poor fat absorption. And yet, how many people ignore this? It's not just about appearance, it's also about frequency. Having a bowel movement daily is ideal for most people. Some go twice a day, others every other day. But sudden changes are dangerous. If you are always regular and suddenly start going days without going, that's a sign. If you are regular and suddenly develop constant diarrhea, that's a sign. If you start alternating between constipation and diarrhea, that's a sign. Your body does not change without a reason. Stress can affect it, anxiety can affect it, poor diet can affect it, lack of water can affect it, medications can affect it, hormones can affect it, but much more serious causes may also be behind it. Chronic inflammation, intestinal diseases, irritable bowel syndrome, polyps, tumors. And here we reach the most frightening point. One of the most ignored and most dangerous signs is when stool becomes very thin, narrow, pencil-shaped. This is not coincidence. It is not trivial. It is not normal. When this happens persistently, it may mean something is narrowing the inside of the intestine. Something is taking up space. Something is partially blocking the passage. And that something may be a tumor. Yes, cancer. A cancer growing slowly inside your intestines, tightening the channel where stool passes, changing its shape, altering patterns without causing pain at first, without clear early symptoms, silent, subtle, dangerous. Another serious sign is the constant feeling of incomplete evacuation. You go to the bathroom, you strain, you pass some stool, but you feel there is still something there, that you didn't empty completely, that you need to return several times, that you never feel satisfied. That is not normal. It may indicate inflammation, muscle dysfunction, obstruction, abnormal tissue growth. Another ignored sign is frequent urge to go without being able to pass stool, that constant pressure, that urgency that leads nowhere. Many think it's just nerves, just anxiety, just diet, but it may be much more. Colon cancer, also called colorectal cancer, is one of the deadliest in the world, and the most frightening part is that in many cases it could have been detected early. It does not appear suddenly. It starts small, it starts silent, it starts without pain, it starts with subtle signs. Changes in stool shape, changes in frequency, feeling of incomplete evacuation, occasional blood, mucus, excessive gas, persistent bloating, unexplained fatigue, unexplained weight loss, and most people ignore it because no one wants to think about cancer. No one wants to imagine it. No one wants to face that possibility. It's easier to pretend everything is fine. It's more comfortable to flush and move on until one day the diagnosis arrives, and with it, regret. I noticed things were different. I knew something wasn't normal. I felt something was wrong, but I ignored it. How many times have you heard that? Your body is intelligent. It doesn't speak with words. It speaks with signs, with symptoms, with changes. And the toilet is one of the main communication channels between you and your health. Ignoring it is like turning off a fire alarm because the noise is annoying. Beyond cancer, untreated intestinal problems can cause serious consequences. Chronic infections, inflammation, nutritional deficiencies, anemia, weakness, lower immunity, skin problems, mood problems, sleep problems, heart problems. Everything starts in the gut. That's why many specialists call it the second brain. It's where nutrients are absorbed, hormones are produced, immunity is regulated, communication with the nervous system happens. When the gut gets sick, the whole body suffers, and yet it is neglected. Now think honestly. Do you observe your stool? Do you know what it usually looks like? Do you notice when it changes? Or do you simply ignore it? Creating this habit takes only a few seconds. A quick look, a simple observation, minimal attention, but it can save your life. If you notice persistent changes for weeks, if you see blood, if you notice very thin stool, if you feel frequent pain, if you constantly feel incomplete evacuation, if you alternate between diarrhea and constipation, if you lose weight without reason, if you're always tired, do not ignore it. See a doctor, get tested, investigate. Do not fear diagnosis, fear ignorance. The earlier a problem is discovered, the greater the chance of cure. Less aggressive treatments, less suffering, better quality of life, more time with those you love. Do not wait for pain. Do not wait for constant bleeding. Do not wait for collapse. Your body is already talking to you every day, in the bathroom, in the toilet. You just need to learn to listen. And now that you know, don't pretend you didn't hear. Observe, care, respect the signs, and if something is wrong, act. Share this warning, because someone you love may be ignoring their own signals right now. Someone may be flushing away their body's cry for help without realizing it. And this information may be the difference between health and disease, between time and regret, between prevention and despair. Your body speaks. Listen.